Good morning. Do you know that we spend almost 1/3 of our lives at workplaces? Wrong seating postures or poor workspace ergonomics, all these can damage spinal structures or add stress to our joints, which in turn can lead to osteoarthritis. Let's understand more about workspace ergonomics and osteoarthritis in our upcoming session of Apollo 24/7's Health Hour. Join us in this live session where we're going to be joined by Apollo's expert orthopedic Dr. Saif Nabi Shah. 11 o'clock, we are going to answer all your questions. Join us there.
माल पूरा है।
हाँ सर,
मम्मी,
पूरा है।
पापा टाइम पे
है अपोलो से है सर।
थैंक्स सर। पापा के बीपी का इशू है, सो एवरी मेडिसिन हैज टू बी ऑन टाइम।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं अपनी पूरी प्रिस्क्रिप्शन की डिलीवरी सिर्फ 2 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar. Welcome to Apollo 24/7's Health Hour, a show which brings you experts from Apollo every week to your doorstep. This is a show where you can ask all those questions and queries that you've been postponing. जो physical मुलाकात डॉक्टर से नहीं हो पाती है, this is the show where you can ask the questions and get an answer or a solution, or maybe you can plan your visit according to this the suggestion or advice that the expert gives you. Today, we are going to talk about workplace ergonomics: what, when, why, and how does it impact our orthopedic health. Joining us very shortly on the show is Dr. Saif Nabi Shah, who's a senior consultant orthopedics and joint replacement Apollomedics at Apollomedics Super Speciality Hospital, Lucknow. तो गेट रेडी विथ योर क्वेश्चंस. बैक एक, नेक एक, या काम करते हुए आपको रिस्ट या एल्बो का पेन होता है, जो भी आप पूछना चाहते हैं, प्लीज गो अहेड, आस्क दीज क्वेश्चंस इन द यूट्यूब चैट बॉक्स. We shall take these questions in the show and place these questions before doctor, and you will find to get you an answer. Also on this show, you will find coupons which will be given away. And I'm also going to ask you 3 questions in the health quiz. You can win prizes from Apollo 247. I urge you all to download Apollo 247, which is literally having entire Apollo in your hands. Before we start the show, let me also talk and appreciate this wonderful initiative by Apollo Foundation and Apollo 247. Sachi, that is Saving a Child's Health Initiative, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. So you must understand that there are a lot of children in India who require specialty pediatric consultations. More than 10 plus pediatric specialists are available, who are renowned Apollo pediatricians, who are giving their consultations for free. Scan the QR code to know more, and please spread the good word. चलिए आज का शो शुरू करते हैं. टुडे वी आर गोइंग टू टॉक अबाउट वर्कप्लेस ergonomics and how does it affect our orthopedic health. Joining us is Dr. Saif Nabi Shah, who's a senior consultant orthopedics and joint replacement surgery at Apollomedics Super Speciality Hospitals, Lucknow, whose career is spanning more than 21 years in orthopedic practice. He's a Zimmer Fellow in joint replacement surgery, fellowship in arthroplasty from Germany, involved in DNB training and teaching program as well. He's published author research papers and various national and international journals as well. Namaste, doctor. It's a great pleasure and honor having you on the show, Dr. Saif Nabi Shah.
Good morning, and thank you very much for inviting me on this talk show and the most talked about topic in orthopedics.
Perfect, and very well right time, because we've all been through a series of lockdowns, working from home, and then moving on to the workplace. The right time to address our ergonomic and ortho issues, doctor.
Exactly.
Nothing better time than this. Yes.
Yeah.
And right now, a lot of people have been waiting for you. We see that today's episode has got a lot of attention. That means it's not just your followers or my followers or people who generally are watching this show for a long time. The issue itself is quite talked upon and very, very important subject. Let me first ask you, what is ergonomics and why is it important for our health?
Most welcome everybody to this talk show by Jhansi and by Apollo 27. Actually, Jhansi, ergonomics literally means laws of the workplace.
Okay. Ergo is work.
Work and means the laws of or the rules of the workplace. So ergonomics literally means laws of the workplace.
Right. So the comfort, or how you sit, how you work, the lighting, all of that comes into it.
Everything. Physical things and environmental things also, including the light. I mean, the temperature of the offices or the workplace, your chair, workstation, laptop, everything. And your stresses also at the workplace.
Yes, which I'm not sure we will be able to deal here. In some other day we will. But let's talk about the ergonomical impact on our musculoskeletal or orthopedic issues. Why is it very important to have good ergonomical practices?
Jhansi, actually, if you see, my 50% of my practice in the hospital, younger population is coming to me with the complaints of neck pains, mostly neck pains, back pains, elbow pains, wrist pains, and mostly these are office goers, IT sector people, bank people, any office goers are coming. This is mainly because our muscles are weak, and the stiffness in the muscles, weakness in the wrong things at the workplace, wrong chairs, workplace, workstation. All these things are adding up to all these. To the pains and stiffness in the body.
So, how is it directly impacting the way that I'm sitting? Why is it affecting my spinal health or joint health? What is the pressure which is applied on the joints, and why is it leading it to serious concerns?
Many things are responsible for this. You know, every cloth doesn't fit everybody. So, at the workstation, all the chairs are the same, all the tables are same. The light is same, temperature is same in the office. So, it doesn't suit everybody.
हाँ,
So,
कोई लंबे हो सकते हैं, कोई छोटे हो सकता है, किसी का लेग ज्यादा हो सकता है. हाँ.
किसी को जो है टेम्परेचर 20 डिग्रीज अच्छा लगता है, किसी को 25 अच्छा लगता है. So, these are all the things that are coming in our workplace. Yeah.
Correct. So, do you mean to say that our workstations or work from home koi karte hai, ya people who are going back to their work, the chair, the desk, the reach of the things, is that important to put some attention and detail into place?
Yes, yes. Let me start from the foot. Most of
Food.
the people don't use the footrest. Footrest should
Correct.
be there. There should be a inclined bench at your foot. Footwear is also very important. Footwear,
Acha.
footrest, yes, and your clothes also.
Okay.
Too tight clothes or too tight your clothes are also not very good. And your chairs
Okay.
also. Chair should be very, very comfortable. You should put something in the small of your back, and you should have a back support, and you should have a neck support, and you should have an armrest in the chairs. Your table should be big enough. Uh, L-shaped tables are better than the simple tables. L-shaped tables are better. Each of the things at your desk is quite important. You know,
Okay.
do-
Okay.
uh, right? Yeah. The height of the things at your in your almirahs is important. Reach of the
Okay.
things, everything is important. Yeah.
So when I talk about workplace, a few people who are privileged go to their offices, but there are a lot of people, workforce in India, where workplace is everything. कोई बाहर जाके काम करते हैं, कोई बेचने वाले होते हैं, या कोई घर में काम करने वाले होते हैं. Even people who are at home and working, for them also ergonomics do play an important role, right? While cooking,
Yes.
while cleaning.
Definitely yes. Definitely yes. Reach of the things is the most important thing. Repetitive injuries is the most important things which we are incurring every day doing the same kind of work at the same place. So it should be changed. Yeah. Yeah.
So repetitive injuries is something that should be taken as a
Repetitive.
warning signs. If people are involved in repetitive work, वही
Yes.
काम बार बार करते हैं, even if it is
Right.
laptop and typing also, that is also a repetitive work, doctor?
Jhansi, we are typing at least 50,000 to 2 lakh strokes per day if you are typing normally. Yeah. So if you do not have a wrist support, if you do not have a arm support, तो आपको एक दिन अल्टीमेटली रिस्ट में और आर्म में पेन होगा. So हम लोग की टेबल्स इस टाइप से डिजाइन होनी चाहिए ताकि वो पुल टेबल्स हों, so we can just pull the keyboard out and we can rest the arms over the chair and then we can do it. Yeah.
Right. That needs a lot of thought, care, and attention in such details. I hope India's ergonomical policies will be taken care well by employers and larger companies which are already
They
putting in
are, yes,
effort.
in the last, yes, yes, yes. They are in the last few years. All these, IT sectors are coming up. IT hubs are coming up. So companies are paying attention to all these, ergonomic things.
Okay. So let's understand what are
It's a
these
hot topic,
postural issues.
now.
Yes, doctor.
You
It
know,
is.
it's a
It
hot
is.
topic these days. Yeah. Yes, yes.
It is.
And mostly
So
after
what is
COVID, mainly. Yeah.
so COVID, yes. Work from home impacts आपने देखा है कि आपके क्लिनिक में while people have shifted their works while COVID lockdown में घर से काम कर रहे थे, did the postural impact hit them more at work, work from home mode?
Most of the people are lying in bed or on the sofa and slouching and for hours
I
and
had
hours
my
and doing
child doing classes all through like that. वो ऐसे लेट के
eating,
सुनती थी classes.
eating. And actually, Jhansi, one thing more, कि हम लोगों के muscles actually are weak mostly because, as a habit, we do not, exercise, you know,
Correct.
of about, uh, मेरे पास जितने भी पेशेंट्स आते हैं 80% ऑफ द पीपल कम टू मी आई आस्क देम कि आप कभी एक्सरसाइज करते हैं नहीं करते हैं लोग इवन द यंग लॉट डू नॉट डू एक्सरसाइजेस सो हम लोगों के मसल्स वीक होते हैं और वो जैसी मसल्स पे स्ट्रेस पड़ता है सो दे आर लाइक आई मीन दे पेन
Yes, yes. So let's understand that posture has a large impact on the orthopedic issues. So what are the tips that you would want to give? What are the things that I need to keep in mind?
neutral posture is important and actually we will be working in the middle of the range of movement of the joints like neck should not be like this or this.
Okay.
It should be straight, back should be straight. I mean, arm should be at a flexion of about 30 degrees, 40 degrees. Wrist should be slightly like this while, working. So, middle of the range of movement should be there. So, I mean, while you type, so you type like this, all these things. So, chair is important, foot rest is important, and stretching for about 5 minutes every hour is important. Just go around the office and walk for you have 5 minutes. Ankle pumps is very important. Ankle pumps you can do always while you are sitting in the chair also. And
आप जैसे
quadriceps
बोल रहे हो मैं यहाँ
exercises,
पर कर रही हूँ.
thigh exercises you can do while sitting. You can do the
Okay.
Kegels exercises. People can just go online and Google all these things.
Okay. Great. So also same similarly neck exercises भी कर सकते हैं, shoulder भी कर सकते हैं, बैठे हुए कर सकते हैं
Yeah.
ये पूरे.
Neck, I would just like to tell you, people can note all these things. Isometric exercises of the neck. Isometric exercises. Just put like straight. Force it. Force it. Count up to 10, and then you release it. Do not do like this. Just keep your head straight. Force in front. Count up to 10, and then you release. 10 times in the front. 10 times in the back. 10 times on the right side, 10 times on the left side. This is isometric exercises of your spine, cervical spine, neck region. Shoulders you can just can stretch a little. Back you can stretch. Ankle pumps you can do. You can do quadriceps exercises.
Okay.
Yeah.
So now that you were mentioning that overall exercise plays an important role, I will give you my personal example before I take questions from the audience. I was overweight, I was not exercising well, and I went into a neck. My hand wasn't helping me, neck injury से. I was thinking कुछ तो हो गया है, ये numb हो गया है, यहाँ पर काम नहीं कर रहा है, ये काम नहीं कर रहा है. I visited n number of orthopedics, neurologists, and everything possible. And when I lost weight, when I started doing yoga, that's when magically my physical ability, all these pains have disappeared now. I know where it
Yes.
starts and how to take care of it. So,
Jansi, I so much stress all these things to my patients. I tell them that you will keep coming to me and you will keep coming to me if you will not lose weight. I was about, 83 kgs. Now I'm 60,
wonderful.
and it was,
And
yeah. Because,
such a
mainly through
great
the diet.
motivation, not for only the person who has gone through that weight loss journey, but also to people to see you that into that transformation. That journey itself is very motivating, doctor. Congratulations.
My uric acid was, 8.9. I was pre-diabetic. I had backache. I had knee pain. I had neck pain. Now, everything is gone. Just by
That's it.
losing weight. And, exercising at home. A little exercises at home for about 10 minutes in a day. That's it. That's it. So you don't need to, hit the gym and, and become
Yes,
a bodybuilder.
hardcore exercise नहीं करनी है, but long, continuous, being at it and having
I'll
a
just tell
great,
you,
yeah.
I'll just tell you one thing, Jhansi. One thing which is very very important. Jogging is totally out of fashion these days for the people like us. People like us, those who are not doing it, regularly. do not jog. Just do, brisk walking 3 times in a week and, half an hour. That's it. And do some exercises at home. Isometric exercises, do planks exercises. Core should be strong. Core muscles should be strong. That's it. Yeah.
Core and which other muscles did you say, doctor? I just missed it.
Core muscles should be strong. Our back, our gluteus, hip muscles, and our thigh muscles. Core should be strong. Planks is the best exercise I advise to my your patients who can do it. Quadriceps
Wonderful.
exercises, ankle pumps. That's it. That's it. Yeah.
Great. So with that motivation that डॉक्टर साहब खुद वैसे जगह पे गए थे जो आउट ऑफ कंट्रोल जाने वाला था and he got it back into his control, and I think we should all take motivation from him and continue. Doctor, there are a lot of questions from the audience. I would want to take Ankur Bharadwaj's question as the first one. My job requires me to stand at a stretch as well as use computers extensively. For the last few days, I'm suffering from spasms in my lower back at the left side, which is worsening at the night. There is a tremor in my right hand while writing with a pen, but I don't have this problem while writing on a blackboard. This has been going on for many years. So, any advice for him?
Actually, I'll just advise him to, do back extension exercises, right? And do,
Okay.
Ankle. He can just stand while he's working, and he can just go, up and down, up and down,
Okay.
right?
If he's
He can
standing.
do that. Yeah, yeah. And for his, numbness in the hand, some people have got this, writer's cramp. राइटर्स क्रैम्प इज वन थिंग कि आप जब ज़्यादा लिखते हैं तो आपको जो है ना हाथ में बहुत ही जो सीवियर पेन होता है. सो यू कैन यूज अ थिक पेन टू राइट, right? A thick pen to write. Do the exercises of your neck. Do the extension exercises of your back, and do the ankle pumps. And you see the doctor if your pain is going down into your leg. I mean that could be a nerve impingement also, what we call as sciatica in the layman's term. So you see the doctor, he can examine you, right?
So I
And
see
do
a
not take
lot of.
one thing
Please
more,
continue.
and do not take over-the-counter medications. See your signs of inflammation and pain. There could be an alarm also for something.
Yes. Yes. The writer's cramp you were talking about, I experience it so much that change. I have the right desk, right inclination, and taking breaks between writing. It helps me a lot, and I resolve my issue of the writer
Yeah,
cramp.
yeah.
I know that
I had
whenever
it.
it's. Yeah.
I had it. I use a thick pen now to write.
Wonderful, doctor. Thank you so much for that tip. Then this is Krishna Ketur, diabetic hai, hypertension under control. He regularly walks for 70 to 80 minutes. He worked on desktop for 20 years. He's 73-year-old now. He had desktop job mein the 20 years, had neck pain. Now working on laptop for 15 to 20 hours a week. But I still get neck pain leading to a headache. Kindly advise.
Isometric cervical spine exercises, what I demonstrated. Only the isometric cervical spine exercises control your blood sugars and control your weight if you are, overweight. That's it. That's it.
That's it. All right. And
And
also
take
at
some
that
B
age, I
complex.
suppose. Yeah.
And take some B
Right.
complex. Age is no bar. Age is no bar. 73 is young for, orthopedics. We take 73 as young in orthopedics.
Oh, that's nice.
Yeah.
Right.
Yeah.
Good. Alok Juyal is asking this question. My wife is pregnant and she's getting a lot of wrist pain only in right wrist. She's working in an IT firm.
Yeah. It could be a carpal tunnel syndrome because, in pregnancy, all these things, a carpal tunnel is sometime there. So after the delivery of the baby, I think it should be, all right. She can just take paracetamol, SOS, if the pain is there, and she can use a wrist splint at night. That's it. A wrist splint. You can just,
जो
Google
fat
it.
मिलता है,
Okay.
then you can put it up.
Wrist
Yeah.
splint she can wear at night or, in the day also sometimes.
Done. So it's again, she's working at the IT sector. Maybe she should be taking care of the repetitive, repetitive
Must be,
motions.
must be. Yeah.
Yes.
She could be having those
Next,
injuries also. Yeah.
sorry, doctor. If will you please repeat that
Tell
sentence?
tell me. It's okay,
Yeah.
it's okay. So you can go ahead.
All right. My mom is having a spinocerebral ataxia and done with genetic test SCA 123 and got result as negative. Is there any treatment to cure spinocerebral ataxia? This is around 4 years back. I'm not sure that is the
Beyond,
question that we can
there's
take
no
here.
beyond the scope of my discussion in this.
All
And
right, doctor.
basically
But
the neurosurgeons see all these things, but isometric cervical spine exercises are the mainstay. She should not bend her neck into these exercises, never ever. It should always be isometric exercises of the neck. That's it.
all right. So Alok ji, आप क्या कर सकते हैं? Apollo 24/7 do support with other specialities as well. You can consult. अगर आपको डॉक्टर सैफ जी से बात करनी है, you can reach out to him on 247 as well, or you can consult any other super specialist, which who can treat this. Yeah. Next question is, my uh, जॉइंट रिप्लेसमेंट सर्जरी के बारे में है. इज जॉइंट रिप्लेसमेंट ओनली ऑप्शन फॉर एज ग्रुप of 55 to 60 when there is severe meniscus tear? Is it reliable and what is the success rate?
Not really. That depends upon the condition of the patient also. Uh, you know, meniscal tear is not an indication for the surgery. ऐसा नहीं है कि meniscal tear है तो हमको उसको operate कर देना है, joint replacement कर देना है. But yes, meniscal tear can lead to arthritis in the joint later on. So ये meniscal tears में you can go to the doctor, वो आपको वो कर लेंगे, वो आपको एग्जामिन कर लेंगे. एमआरआई आपका बता देगा कि उसमें कितना मेनिस्कल टीयर है. यस, अगर मेनिस्कल टीयर बहुत ज़्यादा है और उसके साथ साथ आपको जो है काफ़ी जॉइंट भी हो गया है डिस्ट्रक्शन, तो उसमें जॉइंट रिप्लेसमेंट इज़ अ गुड ऑप्शन.
Okay. Next question is Ramya Nagaraj's question. I'm having right side low back pain. Is this kidney or any other back pain related?
That depends upon the location of the pain. If it is in the higher up on the side of the back, so it could
So
be a
that's
kidney
somewhere
pain,
here.
but it is somewhere here, a little in the front, on the side of the back, upper. So it could be a kidney patient. She can get ultrasound of the abdomen done, and then X-ray of the pelvis with both hips. So that will just rule out the pain.
So once we
Only
understand that it is not the kidney which is involved, then she can come back to understand what is causing her back pain. But posture-related back pain, which can be
maybe
confused.
Yes. Posture related back pain can be confused with the kidney pain a lot. Yes.
Yes. So yes, exercise helps you, Ramya. Doctors undergone a great transformation. I am here again, who's done wonderful. I've experienced great benefits with yoga and exercise. So one must exercise. Doctors
One
are
thing more,
bar bar.
Jhansi, one thing more, Jhansi, I just want to tell. She should not start on the exercises until the pain is diagnosed.
Acha. Okay.
She should not just go and hit the gym or do the exercises on her own until the pain has been diagnosed. That what is the cause of pain. She should see the doctor, get herself examined, get the ultrasounds done, get the X-rays done. After that, only she can resort to exercises if needed. Yeah.
Done. So Ramya was, in fact, while we were talking, she was asking, please suggest some exercises. So I don't think.
Yeah. Suggest what? Suggest what?
She was
Exercises.
asking, yes, she was asking you to suggest some exercises. So
Not now. She should see a doctor, get herself X-rayed, and then see the treatment.
yes. All right. Vinay Gupta ji पूछ रहे हैं, I'm having ITB syndrome, taken physio for 3 weeks and taking pregabalin, but not yet symptomatic relief नहीं मिला है. What should I do? Doctor, what is ITB first, please?
ITP is idiopathic thrombocytic purpura. ITB is what? I mean, No.
I'm not sure. They've written ITB, B for Bangalore. I'm not sure if that's the right word. So मैंने भी सुना नहीं था पहले. For which could be a P, which is confused. Or Vinay Gupta ji, if you can please continue in the next message कि क्या है आपका issue. We'll take the question up later. All right.
If you can just tell
Arun
us
Kumar,
symptoms. If you can just tell
ask
us
for.
symptoms.
ठीक है विनय गुप्ता जी अगर आप शो देख रहे हो इफ यू आर स्टिल ऑन लाइव विद अस प्लीज गो अहेड एंड टाइप योर सिम्टम्स एंड किसके लिए आपने फिजियो लिया था आप जरा फिर से एक बार टाइप कीजिए सो नेक्स्ट क्वेश्चन इज बिफोर ही टाइप्स एंड गिव्स अस अरुण कुमार कपूर इज आस्किंग नी रिप्लेसमेंट is it the only remedy to get relief from knee pain or exercise can exercise help me
That depends upon the grade of knee arthritis, grade 1, grade 2, grade 3, and grade 4. In severe osteoarthritis, yes, we do do a knee replacement, but just for knee pain, so we I mean उसमें तो नहीं है करने की जरूरत बस बट इसमें ये होता है कि आपके पास पेशेंट किस स्टेज पे आ रहा है बहुत ज्यादा अगर सीवियर है आर्थराइटिस तो फिर वो बगैर नी रिप्लेसमेंट के ठीक यूजुअली नहीं होता है यस
So, what are the general knee exercises for keeping the knee health, the joint health?
Quadriceps exercises, quadriceps strengthening exercises, ankle pumps are the exercises. Quadriceps, QUADRICEPS. Quadriceps exercises, ankle pumps. Yeah.
Nice. ठीक है. So विनय गुप्ता जी ने टेक्स्ट किया है.
Sorry, Jhansi. Yeah, one more thing. Do not use a Indian toilet seat. That's very important. Yes. Do not use a Indian seat.
जो squat करके नीचे बैठना पड़ता है. That you mean to say that is going to impact the joint?
Yes. नहीं करना चाहिए वो. अगर आपको आर्थराइटिस है तो वो ये फर्दर और ज्यादा डिस्ट्रक्शन कॉज करता है एक्सट्रीम ऑफ फ्लेक्शन ऑफ द जॉइंट्स सो इट इज नॉट एडवाइजेबल या
ओके डन सो ये विनय गुप्ता जी ने वापस टाइप किया है उनको पेन इन द लेफ्ट लेग लाइक सियाटिका पेन की तरह आता है एंड ही हैज टेकन फिजियोथेरेपी सो दैट मस्ट बी आईटीपी
उनको एक्चुअली अपना वो कराना चाहिए एमआरआई कराना चाहिए आई एम नॉट श्योर कि उनका हुआ है कि नहीं हुआ है हो सकता है कि उनको कुछ नर्व इम्पिंजमेंट हो रहा हो या
ओके
एमआरआई ऑफ द लोअर बैक
Okay, ITB is iliotibial band syndrome. All right, somebody has texted a thing for me. Thank you so much.
So I think he should take rest. Yeah.
All right.
It will be all right.
So next, done. My wife is suffering from drug-induced neuropathy due to chemo and diabetes in the foot area from last 5 years. Not much relief by popular drugs. Any suggestions how she can improve her condition?
Drug-induced
neuropathy. शायद movement में issue होगा and
she should take on some B complexes. पहले से भी ले रहे होंगे B complexes वो exercises करेंगे and I think that's it. So you can't do much about it. Exercises and B complexes. That's it. Yeah.
Okay. Here's Neeraj Chipurpalli. I went through a surgery where my right femur was resected and replaced with the prosthesis. Now my mobility is very restricted due to the lack of strength in the right thigh. What exercises do you suggest?
In the right thigh. So I think इनको वही quadriceps exercises and he should do hip exercises also. Some hip exercises. Yes. बहुत ज़्यादा इनको actually exercises बहुत ज़्यादा नहीं करनी चाहिए. He should not overdo it because his part of his bone has been taken out. और इनको जो है artificial prosthesis लगा होगा. So he should not gain weight. He should exercise a little and that's it.
Ji. Yeah. All right. So next question is Anand Narayan. My wife is 40-year-old. She's a teacher and she's a thyroid patient. Thyroid बोले तो उनका effect हुआ है. What are the exercises for upper back pain? Despite physiotherapy, the pain seems to be coming back. So teachers, again, long-standing hours and ergonomically हम देखते हैं तो blackboard सही नहीं होता है. वर्किंग डेस्क सही नहीं होता है, उनको करेक्शन करना पड़ता है.
Many of the teachers come to me and they are having backache and the shoulder pain because उनको actually blackboard पे हाथ करके बहुत देर तक लिखना पड़ता है, तो उनको काफ़ी impingement syndromes होते हैं shoulder में. I'm not sure whether she is overweight or not, but she should do spinal extension exercises, lose her weight. या अगर उनका weight ज़्यादा है तो उनको weight lose करना चाहिए and spinal extension exercises करनी चाहिए. That's it. Yeah.
Done. Done. नरेंद्र बाबू पूछते हैं, डॉक्टर नमस्ते, आई हैव अनडिफाइंड आर्थराइटिस एंड on he is on Lefno 10 mg per day over last 6 months. All the blood tests are negative. Now all in control. Is this reversible?
Arthritis is usually not reversible. It's like my brain hairs.
Okay.
वो कभी काले नहीं होंगे, इसलिए जो है arthritis can be controlled with some drugs and with some वो exercises, but वो जो है reversible नहीं होता है usually. Yes.
जी जी, रिवर्सिबल नहीं होता है. सो लाइफ लॉन्ग मैनेजमेंट होता है क्या डॉक्टर?
लाइफ लॉन्ग मैनेजमेंट होता है. आर्थराइटिस भी एक्चुअली बहुत टाइप के होते हैं. हम लोग जो है सिंपल जो हम लोग नी रिप्लेसमेंट करते हैं, 80% ऑफ द पेशेंट हैव सिंपल ऑस्टियोआर्थराइटिस, जो कि एक डीजनरेटिव जो है चेंजेस है. और एक होता है रिमोटॉइड आर्थराइटिस. रिमोटॉइड आर्थराइटिस इज मोर सीवियर, उसमें फिर आपको लाइफ लॉन्ग आपको जो मेडिसिन खानी पड़ती हैं.
Okay. Done. Here's a very simple question, but important question, because a lot of people do think that joint health के लिए supplements important है. So how long should vitamin D3 and calciums be continued after BMI test? बोले तो one must be understanding.
A very important question. A very very important questions. 80% of our population is deficient in vitamin D. मैं भी जो है कभी कभी खा लेता हूँ विटामिन डी, बिकॉज हम लोग को एक्चुअली सन बहुत नहीं मिलता है. और जो है अच्छा, एक चीज़ और में जो एक मिथ है बहुत बड़ा झांसी, आई वांट टू टेल पीपल कि एक्चुअली विटामिन डी जो हमारे स्किन में बनता है, दैट इज़ नॉट विद द मॉर्निंग सन. मॉर्निंग सन से हमारे यस वो नहीं बनता है विटामिन डी. विटामिन डी कहते ये हैं कि जब हमारा जो शैडो होता है वो हमारी बॉडी से छोटा हो.
अच्छा,
वो जो होता है पीरियड, उस पीरियड में हमारी जो स्किन के ऊपर अल्ट्रावायलेट रेस पड़ती हैं, उससे हमारा विटामिन डी का कन्वर्जन होता है.
but the shadow is longer in the morning and evening, and
Yes,
shadow
नहीं?
is shorter only when the hot sun is out.
12 to 3 या 12 to 3 इज द टाइम कि जब हमारी बॉडी पे अल्ट्रावायलेट रेस ज़्यादा मतलब हमें जब पड़ती है, उससे होता है कन्वर्जन. मॉर्निंग सन इज नॉट दैट efficient. So हम लोगों को अपना विटामिन डी टेस्ट करना चाहिए, विटामिन डी खा लेना चाहिए. कैल्शियम्स should not be taken at a stretch. ऐसी पेशेंट्स आते हैं मेरे पास कि वो जो है महीनों और सालों से कैल्शियम खा रहे हैं. कैल्शियम शुड ऑलवेज बी टेकन एज पल्स. आप ले लें 1 महीना, फिर आप बंद कर दें 1 महीना, फिर से आप ले सकते हैं. So,
Yeah,
on and
so
off.
pulse, on and off use करना है. Continuing to in the same segment of questions, doctor, Anamika Maji is asking, I'm suffering from low vitamin D level since 2 or 3 months. She's got a test done. The gluteal muscles hurt. Taking medicines, the pain has reduced to some extent. Please suggest some remedies to recover fast. अगर कोई उनका लेवल कम होता है, what do they do?
she can take that depends कि उनका लेवल कितना है. अगर ये बहुत ज़्यादा लेवल कम होता है, so we usually give injections to the patients. अगर नहीं उतना कम होता है तो हम उनको medicines देते हैं weekly, which is taken for about 3 months initially. So she can take weekly vitamin D, 60,000 international units weekly for about 3 months. And she should do, Kegels exercises, Kegels. She can just Google and do the Kegels exercises for the gluteus muscles.
Done.
Kegels exercises, yeah.
Yes, that's a great suggestion. Anyway, you're suggesting exercises. So Rajesh Mohan is asking, what are the upper body exercises that one can do to keep our neck and upper back and the lower back in correct postures and injury free? Well, exercise is important to keep yourself injury free, but what is the correct exercise? Dr. Saab to emphasis करते आ रहे हैं, but one more repetition will do.
First thing, And the most important thing, do not over exercise.
Okay.
I see, I see a lot of patients who are coming to me कि गए जिम में और उन्होंने वहाँ एक्सरसाइज की, वहाँ के जो कोच ने एक्सरसाइजेस कराई, and they come back to me. कल ही मैंने एक पेशेंट देखा है, a young boy. So
Okay.
बहुत ज़्यादा वेट ट्रेनिंग नहीं करनी है, most important thing. वेट ट्रेनिंग बहुत ज़्यादा नहीं करनी है. नेक की आप एक्सरसाइजेस करें, आइसोमेट्रिक नेक एक्सरसाइजेस and spinal extension exercises, and keep your weight low. That's the key to your, health.
Weight
Eat less.
management is very important. Yes, yes.
Eat
Done.
less.
Yes, doctor. So that was Anand Narayan's question. Next, I'm going to ask you this surgery. I'm suffering from back pain while standing for an hour. This is Fakre Alam who asked the question. Fakre Alam जी के साथ काफी सारे लोग पूछते हैं. अजय प्रसाद जी भी पूछ रहे हैं कि बैक पेन होता है while I'm standing for more than half an hour. So standing and back pain. So दोनों का अगर एक क्वेश्चन में आंसर कर सकते हैं डॉक्टर.
I mean the maximum जो आप पेशेंट्स देखते हैं ऑर्थोपेडिक प्रैक्टिस में वो जो है बैक एक के होते हैं. एंड दैट डिपेंड्स अपॉन के जो पेशेंट्स की एज कितनी है, बैक पेन जो है कब स्टार्ट हुआ था, पेन का जो है पैटर्न क्या है, पेन जो है नीचे जा रहा है कि नहीं जा रहा है. सो इनसे ये कहिए कि अगर इनको बैक पेन है, सिर्फ अगर बैक में पेन है, और तो ये किसी डॉक्टर को देख के अपने एक्सरेस करा सकते हैं. और अगर इनका बैक पेन नीचे जा रहा है, समथिंग लाइक अ sciatica, तो इनको हो सकता है कि कुछ नर्व का इम्पिंचमेंट हो रहा हो. तो नर्व का इम्पिंचमेंट हम लोग MRI पे देख लेते हैं, क्लिनिकल एग्जामिनेशन ऑफ द पेशेंट होता है, वो हम देख लेते हैं. सो ये एक बार जो है बैक पेन अगर इनको परसिस्टेंट है, नहीं जा रहा है, सो एक बार एक्सरसाइजेस करने से पहले ही शुड सी अ डॉक्टर.
All right. So, जो long standing work hours होते हैं, for example, even I am standing for a very long time whenever I'm working while on the field. So even I'm standing for a very long time. But does my regular exercise help me?
No, long standing, and if the muscles are paining, that means that the muscles are weak and they are not able to support you.
So will the regular exercise help me, is what I'm asking. Will my
Not the regular exercises. What kind of exercises, I mean, are you asking? I'll just suggest you, spinal extension exercises. That's it.
Okay.
Sometimes reflection exercises also, but the spinal extension exercises are very good. Do planks and do core building exercises. That's it.
Done. All right, doctor. So also for knee, you have already given exercises. Nisar ji पूछते हैं, good morning, doctor. I have pain in my knee. Any simple exercise बोला है. But while you were speaking, sorry, doctor.
No. So you can go ahead. Go ahead. Yeah.
हाँ, निसार पूछते हैं, good morning, doctor. I have pain in my knee. Any simple exercises?
Quadriceps exercises. Quadriceps exercises, ankle. Quadriceps exercises, ankle pump. That's it. Yeah.
Done. Abhishek Lal ji का question है, my mother is approaching menopause and she gets knee pain sometimes. What precautions can she take and her weight is normal? Well, menopause अभी आपने discuss किया था कि women who are at a certain age and osteoarthritis and bone density is quite low. Menopause is one age where women seriously have a problem.
Menopause is a watershed thing in a female's, age thing. Menopause के बाद काफी accelerated bone loss होता है females में especially. And जो है अगर उनको नी पेन अभी हो रहा है तो ये डिपेंड करता है कि उनको नी पेन कितना है, कब से हो रहा है. अगर उनको सिंपल नी पेन है, सो some do's and don'ts are there. जैसे मैंने बताया है, इंडियन टॉयलेट सीट यूज़ नहीं करें, पैरों को बहुत ज़्यादा मोड़े नहीं, फ्लेक्स नहीं करें. अगर मान लीजिए अगर आप पूजा में बैठते हैं या फिर आपको कहीं भी ऐसा हो रहा है कि आपको जो है पैर बहुत ज़्यादा फ्लेक्स करने पड़ रहे हैं, तो आप वो फ्लेक्स नहीं करें, आप किसी ऊंची चीज़ पे बैठें. ठीक है, एंकल पाम्प्स करें और आप क्वाड्रिसेप्स एक्सरसाइजेस करें. और अगर आपका पेन फिर भी ज़्यादा हो रहा है, नहीं जा रहा है, तो आप एक अपना वो करा लें, एक्सरे करा लें, डॉक्टर को देखें और आप एक्सरे करा लें. That's it.
Okay. All right. So next question is Vamshi. I have continuous elbow pain since few days due to sitting posture at work. What should be done now since 2 weeks the pain has not come down?
अगर उनको पेन बिल्कुल जस्ट एट दी एल्बो यहाँ पे हो रहा है, सो वी कॉल इट एज अ स्टूडेंट्स एल्बो, यू नो बच्चे बहुत देर तक पढ़ते रहते हैं टेबल पर, तो उनको यहाँ पे जो है पेन होने लगता है, तो शी कैन जस्ट पैड हर एल्बो a little, and she can take some anti-inflammatory medications like Combiflam or
No,
something.
शायद ये वर्क करते हैं डॉक्टर, बिकॉज आई थिंक दिस इज अ वर्क प्लेस रिलेटेड क्वेरी. ही मेंशन्ड कि ड्यू टू सिटिंग posture at work.
आर्म रेस्ट जो है चेयर के, उनको उनको जो है थोड़ा सा स्पॉन्जी होने चाहिए. आर्म रेस्ट अगर जो है वुडन आर्म रेस्ट है, उसके उस पे आप रोज अगर आप अपना एल्बो रख रहे हैं, तो वो इट इज बाउंड टू पेन.
Okay. Done. So posture related पहले से awareness रहना चाहिए so that this doesn't come. Once the pain has started, what are the measures that one has to take? For example, next question Rajendra Prasad ji पूछते हैं, I'm observing pain in my right elbow, especially when I'm typing for a long time, especially when I lift something. Is it a tennis elbow pain or something else? What should I do?
It depends upon the location of the pain. एल्बो में ऐसे बहुत सारे पेन की जगहें जहाँ पे आप देख के डायग्नोसिस बना सकते हैं. आई एम नॉट श्योर कि इनको पेन कहाँ हो रहा है एग्जैक्टली. टेनिस एल्बो का पेन जस्ट एल्बो के बाहर की साइड होता है, सो अगर जो टेनिस एल्बो का पेन है, सो ऑल दीज थिंग्स लाइक कि आप ऐसे कप उठा रहे हैं, आप जो है चाय पी रहे हैं, और या कोई आप बॉक्स खोल रहे हैं, आप डोर का हैंडल खोल रहे हैं, आप अपना बैग उठा रहे हैं, लेडीज अगर जो है आटा गूंद रही हैं, और या जो है कपड़ों को वो कर रही हैं, तो ये सब चीज़ें नहीं करना चाहिए. अगर टेनिस एल्बो का पेन है तो एंटी इन्फ्लेमेटरी मेडिकेशंस ले लें, थोड़ा सा विटामिन डी ले लें, बिकॉज आई एम श्योर विटामिन डी भी लो होगा इनका. विटामिन डी ले लें, और थोड़ा सा एक टेनिस एल्बो बैंड आता है, उसको जो है यूज़ कर सकते हैं.
ओके. जो वंशी पहले एल्बो पेन के बारे में पूछ रहे थे, जो वर्किंग है, उनका एज है 33 year old. ही वर्क्स एट अ डेस्क फॉर एटलीस्ट 7 hours, एंड उनका एल्बो पेन विच एक्सटेंड्स टिल शोल्डर होता है.
तो उनको ऐसा हो सकता है कि उनको शायद पेन जो है शोल्डर से आ रहा हो बेसिकली. तो उनको अभी ओवरहेड एब्डक्शन बहुत ज़्यादा, मतलब हाथ को ऊपर नहीं लेके जाना चाहिए. मेडिसिन कुछ ले लें, एंटी इन्फ्लेमेटरी ले लें, और एल्बो में अगर ज़्यादा पेन है तो वो एक टेनिस एल्बो बैंड पहन सकते हैं. अपने जो आर्म को रेस्ट करें जब ये जो है टाइप कर रहे हैं. टाइपिंग के टाइम्स एल्बो शुड बी रेस्टेड. अगर वो अगर उसको रेस्ट नहीं कर रहे हैं, अगर वो हवा में है, तो इनको पेन होगा, इन द शोल्डर ऑल्सो, इन द एल्बो ऑल्सो, एंड इन द रिस्ट ऑल्सो. इट शुड बी वेल सपोर्टेड.
Who are working should always be conscious about their posture, especially अगर आपको कहीं पेन है, तो पेन मैनेजमेंट कैसे किया जाए डॉक्टर? एंड आपने बोला कि ओवर द काउंटर पेन किलर्स ना ले, सो हाउ डज वन अप्रोच दिस?
बट घर में देखिए जो है ना, पैरासीटामोल तो जो है सबके यहाँ होता है, सो यू कैन जस्ट ट्राई आउट अ पैरासीटामोल इनिशियली. और दूसरी चीज़ ये है कि अगर आपको यू शुड रिकॉग्नाइज द थिंग्स कि आपको पेन जो है किस चीज़ से एग्रीवेट होता है. डोंट डू दोज थिंग्स. दैट्स द मोस्ट इम्पॉर्टेंट थिंग. सो आप अपना चेयर चेंज कर सकते हैं, आर्मरेस्ट आप चेंज कर सकते हैं, अपना कीबोर्ड चेंज कर सकते हैं, समथिंग लाइक दैट.
Done. All right. So keep your consciousness on and help your body so that you don't. Ergonomics is nothing but helping your body according to what you're saying. So अगर आपको काम करना पड़ता है repetitive injury पे, आपको body if you are posing your body to repetitive motions, then you should aid your body is what doctors keeping in mind, and that's what he's suggesting.
Most important thing, Jhansi, is that control your weight, do regular exercises, control your weight, and do regular exercises, 10 minutes 20 minutes each day at home. जो आपको जिम जाने की बहुत ज़्यादा नहीं है ज़रूरत. जिम में आप जाते हैं तो उसमें क्या होता है कि आपको पता लगा शोल्डर में इंजरीज हो गई, नी में इंजरीज हो गई, और आप अपना जो है एक्सरसाइजेस कीजिए रेगुलरली, कंट्रोल योर वेट, and do not snack in the office.
ठीक है. Yeah. All right. Next, doctor, I would want to take a question who has a disc bulge. But Neeraj Chipurpalli, I want you to type your father's age and other factors also. If you can type the other important details like father's disc bulge between L4 and L5 bulge, right leg is paining. Doctors suggested for a minor surgery. Post surgery do's and don'ts, and do they? He's basically asking कि surgery करवाएं या ना करवाएं. बट एज
What's his
जरा
age?
बता दीजिए. हाँ,
What's
मुझे
his age?
एज नहीं मिला, मैं पूछ रही हूँ. Before he responds, let me take Yellori Kamal. I do jogging 5 kilometers per day. Sometimes I feel pain in my right knee and it goes away without my knowledge. Should I use any supplements like calcium tablets?
First thing, do not jog while you are having pain. अगर आपको jogging से pain हो रहा है, so you should stop now. Let the pain go, and then you can start on the quadriceps exercises, and then you can do brisk walking initially. Okay. अगर आप jog कर रही हैं, so you should not jog on the treadmill. Do not jog on the hard road. Soft earth पे jog कीजिए, and wear some good shoes. And the pain will go. Yeah.
Done. नीरज चिपुरपल्ली रिप्लाई करते हैं, the father's age is 59-year-old and he has L4 and L5 disc bulge. Leg issue है उनका, leg pain होता है. Doctor suggested for a minor surgery. So now he wants to understand, is surgery mandatory? अगर mandatory है तो what are the do's and don'ts after surgery?
One thing, Jhansi, one law doesn't apply to everybody.
Correct.
For the decision of the surgery, two things are important. One is the clinical examination of the patient, and one is the MRI pictures or the any investigation. अगर उनको clinical examination पे भी कुछ deficiency आ रही है और उसमें signs of nerve impingement है, और अगर MRI भी show कर रहा है nerve impingement है और उसमें disc bulge है, so I think he should get operated, because disc is like a toothpaste thing. एक बार बाहर आ जाता है, अंदर नहीं जाता है यूजुअली. या तो अगर एक बार डिस्क बल्ज है उनको, अगर प्रॉब्लम हो रही है, सो ही शुड अगेन दैट डिपेंड्स कि उनको डिस्क बल्ज कितना है. अगर आप जो है पेशेंट्स को रेस्ट करा दें, कुछ आप मेडिसिन दे दें, कुछ आप उनको वो करा दें, एक्सरसाइजेस करा दें, तो 80% डू वेल. बट देन अगेन इट डिपेंड्स अपॉन द स्टेज ऑफ द थिंग.
Done. So Pushpa Bhatt ka question hai, I'm 53-year-old. My right knee is painful when I get up. If I keep walking and do invigilation at school, by the way, she's a teacher. At school, even for 3 hours, I don't have an issue while she's walking or standing up. For lower back pain, no issues. Okay. This started due to the online classes. Her leg issue started because she was working from home and online classes. See, teaching is a profession which involves a lot of walking and standing up. But teachers and students were restricted to home while they were not taking care of their body posture right.
इनिशियली यस, मैं उनको एक चीज़ यही करूँगा एडवाइस कि वो अभी सिर्फ और सिर्फ क्वाड्रिसेप्स एक्सरसाइजेस शुरू करें और कोई भी नी कैप नहीं पहने, बिकॉज अगर नी कैप पहनेंगी तो फिर उनको फर्दर और ज़्यादा मसल्स वेस्टिंग होगी. उनको सिर्फ और सिर्फ क्वाड्रिसेप्स एक्सरसाइजेस करना चाहिए. एंड द पेन इज नॉट गोइंग इन द नेक्स्ट 1 month 6 weeks, तो एक बार एक्सरे करा लें किसी डॉक्टर से कंसल्ट करके.
जी. Mr. Murthy Krishnalanka, this show is meant for the national audience, which will understand Hindi and English. For larger benefit of the audience, we will continue in English and Hindi. Unfortunately, I love my mother tongue. I'll not be able to talk in my mother tongue, which is Telugu. We will definitely do a show for the local audience at a later stage. I hope you will understand this. Dr. Rakshak ka question hai, what is your advice for those who are having a flat foot or having a very low arch?
What's his age? I'm not sure about his age.
Rakshak, will you
Treatment
please
depends
be able to
on
type your age? Yeah, I will wait for his age to come. But flat foot, will this cause a larger issue, doctor?
Not really. थोड़े बहुत मैकेनिकल पेन्स होते हैं. I mean, well, it depends upon the stage कि वो जो है कितना ज़्यादा है. लेकिन जो है मिडिल आर्च सपोर्ट पहन लें, और आजकल बहुत ज़्यादा अच्छे जो है कस्टमाइज्ड shoe insoles बना देते हैं, orthotics. So you can just go to some good, गुड ऑर्थोटिस्ट वो आपके जो है पैर के आपके वो ले लेंगे, कंप्रेशंस लेंगे और आपको जो है कस्टमाइज्ड फुट इंसोल बना देंगे. दैट विल हेल्प यू हिम अ लॉट.
Great, great. So Mr. Nisar is asking this question again. During pregnancy, doctors advise my wife to take 1000 mg calcium per day throughout the pregnancy and after the pregnancy for 3 months. Is this okay to take these tablets for such a long time?
Yes, she can take. Actually, जो है प्रेगनेंसी में अराउंड 1200 milligrams per day का डिमांड होता है. So she can take this 1000 milligrams as suggested
Great.
by the doctor.
All right, one last question, Doctor. Deepa SV is asking, I feel pain in the spine in the middle of the sleep when I move my body. Also, at times, I feel similar kind of pain in the knee. I'm 42 and I'm having osteopenia. What is osteopenia, if you can just explain for the viewers, Doctor?
Osteopenia is something in between a normal and osteoporosis.
Okay.
Right. Osteopenia diagnosis करने के लिए actually densitometry होती है. Osteoporosis can be diagnosed on the X-rays also, but उसको जो exact pinpoint करने के लिए densitometry होती है. So अगर इनको कुछ osteopenia हो रहा है तो she can take some medicines apart from the calcium. कुछ आते हैं medicines आते हैं जो कि bone को थोड़ा सा prevent करते हैं dissolve होने से. मतलब जो calcium को वहाँ से जाने से तो ये कुछ medicine वो ले सकती हैं और ये कुछ calcium ले सकती हैं. Exercises she should start on the exercises because अगर ये exercises करेंगी तो उससे भी इनका थोड़ा bone stock will be all right in the later years of her life. Because यहाँ से one thing, osteopenia can go on to be osteoporosis. इसलिए अगर अभी से prevent करेंगे तो फिर बाद में osteoporosis नहीं होगा.
Okay. Thank you so much, Doctor, for this wonderful session. You've been very patient. Before we sign off, I would want you to give me top tips to take care of our orthopedic issues while working at a desk or working for long hours.
Breaks are very important, right? And you should, respect your position. You should, recognize your inflammation, go to the doctor, maintain a neutral position or posture while you are working, and you should always modify your tasks. That is the key home message I would like to give all the patients.
Yes, Doctor. Thank you so much. It was a great session, and your the focus on maintaining your health as in weight and other issues वो बहुत important है spine health के लिए and joint health के लिए.
Yeah, it was nice talking to you. Thank you very much.
Pleasure, Doctor. Pleasure. Thank you so much. So, Doctor साहब अभी leave लेंगे, but for you, coming up is the health quiz, asking you 3 questions. You have to answer these questions over the YouTube chat only. Winner's name will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And once I declare you as a winner, you will have to mail your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. चलिए आज के 3 questions आपकी screen पर आ रहा है. This is the first question on the screen. Which is the longest and the strongest bone in the human body? Human skeleton में what is the longest and the strongest bone? Where are the hinge joints found in the human body? Hinge joints. Where are the hinge joints found in the body? Question number 3. Which premium membership plan on Apollo 247 app gives you exclusive benefits and discounts? Which premium membership plan on the Apollo 247 app gives you exclusive benefits and discounts? बहुत ही simple answer है. If you know the answer, go ahead type. Otherwise, Google करके answer कीजिए. Last question का answer तो यहाँ पर है. ठीक है? मैंने clue भी दे दिया है. Okay, I am waiting for the answers and the winners. In the meanwhile, let me give you an interesting insight that one tap में आप general physician को consult कर सकते हो. Instant doctor consultation in one tap at ₹1 only. And how is this possible? You want to know more details? Please go ahead and check the other details. This offer is valid only for Saturday and Sunday. That means Saturday हो गया है. ये Sunday के लिए ₹1 में आप one tap में instant consultation पा सकते हैं. There are very few specialties which are available at ₹1 and limited slots. So go ahead, book your slot for this Sunday. If your consultation has been waiting, this is the chance. And also, As we go ahead, let me give you another code. First 3 is the code that you can order your medicines direct Apollo say and get flat 25% off on the first 3 online medicine orders. So you have to use this code, which is called first 3. You can pay via Amazon Pay and earn up to 500 rupees cash back also. So this is one wonderful option, but you will need to download Apollo 247 to use this code there. So download Apollo 247 if you have not. If you have downloaded, go ahead and buy medicines direct Apollo say. Thank you all for joining in this live session. So all the viewers, you can use this code HH247 to get up to 199 rupees off on consultation with Apollo doctors and almost 20% off on medicine orders. You use code HH247. I'm still waiting for the winners this week. Thank you so much, all of you, for asking your questions. Keep safe. And here are the winners. The winners are Neeraj Chiprapalli, Rakshak, and Bhalu Prakash. Congratulations. Please write back to us and claim your gifts. Next week, we are going to talk about an interesting topic, vision loss, the myths and facts. We are going to bring you an Apollo expert. Tune in to Health Hour on 3rd April at 11 a.m. and ask all your questions in the live session. I thank Dr. Saif Nabi Shah for being so patient and answering the questions on workplace ergonomics. And thank you all for joining us. See you next week. Do not forget to subscribe so that आपको reminders भी आ जाएंगे and you will not miss any session, which is very important. Thank you. Bye-bye.